her toes are polished, but I would check for capillary refill if they were not. All right, now I'm gonna cover you back up here and have you scoot down to the end of the bed again, letting your knees hang off. All right, and I'm just gonna have those shown there. All right, can you lift them up for me and let them back down? All right, now can you flex your ankles up for me and push them back down? Can you turn them out and then turn them back in? Great. Smoothly. Can we touch your back again? Tell me if you're feeling tenderness when I do this. Any tenderness? Any tenderness? Great. All right. So if this were to be the female portion of the genital exam, I would assist the patient into the lithotomy position. I would assess the mons pubis, noting general hygiene, underlying condition of the skin, and pubic hair distribution. I would then inspect the vulva, looking for any discharge, sores, lesions, or edema, noting the color. I would inspect the urethral orifice, noting any drainage and the color. Then I would inspect the vaginal introitus. After that, I would get ready for speculum insertion by opening the labia with my non-dominant hand, as well as the vaginal introitus. I would moisten the speculum with warm water. I would insert it at a 45-degree angle downward toward the rectum to minimize discomfort. I rotate the speculum horizontally, open and lock it into place. The cervix should be pink with no lesions, discharge, or drainage. For the bimanual portion of the exam, I would put on gloves, put lubrication on my second and third finger. I would insert it into the vagina while pressing on the lower abdomen with my other hand. I would palpate the vaginal wall, palpate the cervix by sweeping my fingers over the protruding knob, noting firmness, mobility, masses, or tenderness. Then I would advance my fingers forward to palpate the uterus, noting any masses or tenderness. For the rectovaginal portion of the exam, I would have clean gloves on. I would put lubrication on the second and third finger. I would ask the patient to try to relax. I would insert my second finger into the vagina and my third finger into the rectum, and I would press my other hand on the lower abdomen, palpating for hemorrhoids, polyps, or masses. For the breast portion of the exam, I would assist the patient into the supine position with her arms above her head. I would place a small pillow behind her back. Using the vertical strip technique, I would palpate up and down the breast with the finger pads of my 3 middle fingers on my dominant hand, starting on the outer edge. I would palpate the nipple for masses or discharge, and I would gently squeeze the nipple with my index finger and my thumb. For the male portion of the exam, I would assess the pubic hair, noting the distribution. I would inspect the penis, looking for sores, lesions, masses, or rashes. I would inspect the urethral meatus, noting any drainage, and note the position. Then I would inspect the penis, palpate it, the shaft of it for tenderness or induration. I would inspect the scrotum, noting any lesions, masses, rashes, or edema. I would gently palpate using my first 2 fingers and my thumb. And then I would also palpate the spermatic cord and the epididymis. I would assess for an inguinal hernia by inspecting the inguinal area and asking the patient to bear down. And then I would palpate using my index finger and asking the patient to cough, and then repeat the same on the opposite side. For a prostate exam, I would have the patient face forward on the exam table. I would have gloves on. I would apply lubrication to my finger. I would insert it into the anus, palpating the prostate, noting contour, mobility, and any masses. and I would palpate distal to proximal. And that concludes my head to toe assessment. Thank you.